By the end of this video, I want you to have a better understanding of what osteoarthritis is and why people living in our modern society are more than twice as likely to develop osteoarthritis compared to humans living just 70 years ago, and also many more times more likely to develop osteoarthritis than humans living pre the Industrial Revolution. I also hope that you have a better understanding of what you can do starting today to live a more pain-free and active lifestyle. So first of all, you've probably been a little bit misled about what has caused your osteoarthritis, and that is generally due to new evidence just taking a fair bit of time to actually crack into mainstream medicine. So throughout the last few decades, osteoarthritis has been described as a degenerative wear and tear disease where articular cartilage, primarily the shock absorbers in the joint, break down through general loading of the joints over decades. The notion that this occurs through just general joint loading and use couldn't be further from the truth, as advancements in science have shown us that human joints are designed to be used and under normal physiological conditions exhibit little or no wear over decades of use. Loading a joint like your knee or hip is essential for joint health. The articular cartilage inside of your knee joint or hip joint is actually avascular, meaning it doesn't actually have a blood supply, which means that it needs to receive its nutrients through another mechanism, and that mechanism is synovial fluid. Synovial fluid has more jobs than to just nourish the articular cartilage, giving it all the building blocks of life. Synovial fluid is an almost frictionless substance that keeps the articular surfaces of each bone from touching one another. It also helps to disperse the load evenly throughout the joint and even acts as a cleaning system, removing dead or decaying cells from inside the joint. And guess how that synovial fluid moves throughout the joint and the articular cartilage if it doesn't actually have a heart pumping it where it needs to go? Well, that is through loading the joint. So now that we understand that loading joints is critical and essential for healthy joints, why do we get diseases like osteoarthritis? Knee and hip joints have been through the test of time. I'm not quite sure how they evolved to be what they are today, but they require optimal conditions to maintain their properties and structures. However, when these normal operating conditions are disrupted, these systems lose their unique properties and cannot function optimally, leading to rapid degradation of their structural elements. In synovial joints, this degradation generally affects the articular cartilage and the synovial fluid, which leads to what we call today osteoarthritis. So what causes these normal operating conditions to become disrupted? Well, there are many causes, but the main cause, especially in our modern society, is inflammation, and that inflammation is chronic low-grade inflammation. Now, inflammation is not always bad for you. When you roll your ankle and your ankle swells up, this form of inflammation is good. It's an inflammatory soup of healing properties working to initiate the healing process, but long-term low-grade inflammation is actually bad. So why are we getting this low-grade inflammation? Research shows that a major source of this chronic low-grade inflammation is actually coming from the obesity epidemic. This excess body fat produces and releases substances called adipokines, or we just can refer to them as cytokines, into the bloodstream. Many of these cytokines contribute to chronic low-grade inflammation, also known as metaflammation, which the body isn't well equipped to handle. Some of these cytokines have been experimentally shown to play a significant role in triggering osteoarthritis. Now, this table sums up the causes pretty well. So at the bottom, you can see our ancestral environment. And this was pre-industrial revolution. It says here is probably the early industrial kind of era. But you can see down the bottom that there are high levels of physical activity. We have traditional diet, which is low in sugar, low in saturated fat, and high in fiber. You can also see that this then led to low BMIs, so low levels of obesity and low excess body fat. And that metainflammation, so that chronic low-grade inflammation, was quite uncommon. And you can see here that the osteoarthritis prevalence, if you look on that left-hand column, look back across, it is pretty low, but you can see it is rising, and I guess that's probably leading into the early industrial era. But above we have the modern environment. So here we have the opposite. We have high levels of physical inactivity, and that's generally due to having cars, having TVs and sitting on the lounge and watching TV. We have, I guess, jobs that require a lot more sitting. Just everything in general has led to more sitting. Our diets are highly processed. They're ultra processed, they're high in sugar, they're high in saturated fat, and they're low in fiber. And this has led to us having a higher BMI on average. So more people are obese, more people are carrying excess body fat. And that's led to having more cases of chronic metainflammation or chronic inflammation. Okay, and then I'm going to skip straight to this next table, which talks about the issues with physical inactivity. So on the left-hand side, you can see that physical inactivity has led to higher rates of depression. I think this is quite important to talk about, and I could almost make a whole nother video about this, but depression leads to an increase in pain sensitivity. So because people aren't active, they're having higher rates of depression. There's a lot more to that. We could go into it for ages. But anyway, depression leads to a higher rate of pain sensitivity. So people experience pain more when they're depressed, so everything's heightened. We could talk about that for ages, but that's for another video. Okay, so next we have the telomerase shortening. So that's your telomeres, which are on the end of your chromosomes. So they just give us a good insight into how long people are going to live. So if you want to look up telomeres, do that. But I guess the more times our cells have to duplicate, the shorter those telomeres get, which means we age quicker. And so physical inactivity has been shown to physical inactivity has been shown to lead to those telomeres shortening, which promotes aging. All right, so we've also got decreased muscle strength, okay, which leads to joint instability. So having weaker quads, weaker hamstrings, weaker glutes, it's a really important one, leads to joints being not as stable. They're in balance, which means that they're not aligned, which can lead to symptomatic osteoarthritis. Then we have joint immobilization, which is what we were talking about earlier, where if you're not moving that joint, it can't receive the nourishment through the synovial fluid. So then the cartilage and the bone quality actually reduces. Okay, I'm going to explain a bit further in this video about how weight bearing and loading the joint is important for actually increasing the size of our cartilage and the bone quality. But that's going to be later on. So we also have the energy imbalance. So we're not actually burning as much energy when we're physically inactive. And that's also leading to obesity. And then also there is evidence that physical inactivity leads to hypertension, so high blood pressure, insulin resistance, and then lipid abnormalities like high cholesterol, which is leading to metabolic syndrome, which then leads to symptomatic osteoarthritis. So heading back to that joint immobilization, which leads to poorer cartilage quality and bone health. So when activity decreases, the mechanical stress that helps maintain and rebuild joints also decreases, resulting in weaker and less stable joints that are more prone to injury and deterioration. So to highlight the importance of regular joint loading and the use it or lose it principle, studies have actually found that people with paralyzed limbs actually have thinner cartilage on average and experience thinning of their cartilage inside their knee, so that articular cartilage, compared to people who participate in regular weight bearing, loading of their joints. And on MRI, these people who are loading and are active actually have thicker cartilage and fewer defects compared to people who are actually inactive. So not only does exercise have an effect on maintaining and improving joint health, but actually it also has an effect on inflammation. A recent study from Doherty et al., 2022, found that exercise and actually contraction of skeletal muscle leads to the release of another type of cytokine, which actually is anti-inflammatory, which may explain why exercise reduces the susceptibility and the symptoms of other inflammatory conditions, and is critical in preventing osteoarthritis and reducing the symptoms of osteoarthritis. So I'm actually going to loop back to the diet part in causing osteoarthritis. I've got another table here. So this table talks about our modern diet, where we're getting a lot of our calories from processed food or ultra processed food. We have low proportion of fresh fruit and veggies, and high ratio of omega-6 to omega-3 fatty acids. Okay, so if you see to the right here, that our modern diet is leading to obesity. And if you look down to the left of that, so it has those adipokines, which are the cytokines that cause systemic inflammation, and that's now leading down to osteoarthritis. But on the other side, we have joint overload. So our joints are, our joints combined with the weakening of our muscles and us being physically inactive is leading to, the joint overload. So a bit of that malalignment, which is leading to the tissue tear and shear. And that's also leading to the activation of our innate immune response, which leads to osteoarthritis. But interestingly, if you go to the middle, we have intestinal dysbiosis and permeability issues. So pretty much we're having digestion issues in our intestines, which is leading to systemic inflammation, which again leads down to activation of joint and muscle cells, which then leads to osteoarthritis. If you go across, we have metabolic syndrome. So our poor diet is also leading to lipid abnormalities, which are things like high cholesterol. We have insulin resistance and an increased risk of type 2 diabetes, which is leading to, a stiffness of the matrix inside of our joints. So on that bone, we got weakness in our muscles. We have altered proprioception, so we have loss of sensation in our feet and other places. And then that's also leading to some of our bone loss inside of our joints. And then you have hypertension on the other side, which is leads to bone ischemia. So ischemia means, I guess, a lack of blood supply, so not receiving the normal amount of blood supply, okay, which then leads to osteoarthritis. All right, so let's sum everything up so far. So first, osteoarthritis occurs when there is a change or disruption in the optimal conditions needed to maintain a joint's unique properties and structures. 2, loading is extremely important in maintaining these optimal conditions and maintaining optimal health and density of articular cartilage. Physical inactivity disrupts the optimal conditions within the joint and leads to obesity and more inflammation. Physical inactivity also leads to early aging, higher rates of depression, which leads to higher pain sensitivity and weaker muscles that don't support the joint and lead to more osteoarthritis. Our modern diet of ultra-processed food also leads to weight gain, which then leads to more inflammation. The food itself also leads to intestinal issues, which leads to inflammation. The food we eat plus physical inactivity leads to metabolic syndrome, which leads to weaker muscles and poor bone health, which leads to osteoarthritis. Okay, so I also think it's important to add that previous injury to your knee is a major risk factor for developing osteoarthritis. So injuries like a ACL tear, which is an anterior cruciate ligament, a PCL, which is a posterior cruciate ligament, meniscus, those lead to a higher risk of osteoarthritis. You also have the kind of more bony injuries inside the bone, like a patellar fracture or a tibial plateau fracture, and these lead to higher rates of osteoarthritis, and especially if you have a meniscus and an ACL together. But for the majority of the population, this doesn't really apply to you, and what we can focus on is addressing the inflammation, increasing our physical activity, and strengthening our muscles to support our knee joints. So now that you know what osteoarthritis is, what is likely to have caused it, but what can you do about it starting today? Seeing a qualified dietitian or a nutritionist can be a great start to getting your diet back on track and reducing the inflammation. A dietitian or a nutritionist may be able to help you to reduce the amount of ultra-processed food that you have in your diet. They'll also be able to bring some clarity to what you should and shouldn't be eating in a evidence-based way. They should also be able to create a bit of a plan for you and work with you to create a sustainable plan of action and, I guess, diet that you can follow for hopefully the rest of your life. Now to your physical activity. With relation to exercise, there has been extensive amounts of research into how exercise influences outcomes in osteoarthritis. Meta-analyses have reported that exercise improves pain, function, and quality of life for patients with osteoarthritis, and many countries, including the UK and Australia, have exercise therapy as their primary treatment. According to the Australian Commission on Safety and Quality in Health, 9 out of 10 people with osteoarthritis can successfully manage their symptoms with exercise therapy to avoid having a total joint replacement. So what type of exercise should you be doing? Well, actually, the evidence suggests that doing any kind of exercise is actually safe regardless of your stage of osteoarthritis. However, the exercise must be tolerable, okay? So it doesn't increase your symptoms of pain dramatically, and the following day, you shouldn't be in excessive amounts of pain. So let's say your exercise you're doing only causes a 3 or a 4 out of 10, and you can tolerate that. And the next day you don't have an increase in pain, or your swelling has an increase and you don't have a really swollen joint the following day, then that exercise is probably pretty good for you. However, a recent study from the Shelburne Knee Center actually focused on improving the range of motion of your knee, so that flexibility first before then strengthening, and that actually led to 76% of all people needing a knee replacement to actually not need to go through and get it. Their symptoms were resolved enough that they didn't feel like they needed to get one, and they were able to have a good quality of life and become more adventurous and exercise easily without increased pain. It's also important to add that a total joint replacement doesn't automatically mean you're going to have an amazing knee or hip post-surgery, with some reports actually stating that between 10 and upwards of 30% of all total knee replacements result in dissatisfied customers. It's also important to add that actually increasing your range of motion, so that flexibility in your knee, and increasing the strength of the muscles supporting your knee is actually extremely important pre-operatively. Okay, so if you're going through with that total knee replacement, it actually dictates how well you recover. So having greater range of motion or flexibility going into that total knee replacement and greater strength actually led to greater outcomes post-operatively, kind of highlighting the importance of just exercise in general, even if you are getting a joint replacement. Exercise in general will always benefit you on your osteoarthritis journey, whether that is decreasing that inflammation, it's improving your mental health, it's improving the strength and the support of those muscles surrounding your joint, as well as decreasing those levels of pain that you're experiencing. But for the most optimal outcomes, it's best to consult with a physiotherapist or follow a program created by a physiotherapist so you know what to do and when to do it. So I have many examples of exercises that I actually prescribe to my patients with knee osteoarthritis. So I recommend checking out some of my other videos that I have on my channel so you can get a feel for what types of exercises you should be doing for your knee osteoarthritis. Having worked with a lot of people with osteoarthritis, I know how tough it can be and how much arthritis can dampen your life. But I'm here to tell you that it is possible to make improvements and possible to change your life. And it starts with movement. Now, that movement doesn't have to be all the crazy exercises you see other people do at the gym or on social media. It starts with just gentle movement. Do what you can do. Start with what you can do currently. Build on that. I know it's overwhelming at times, but you just got to start with simple movement. And over time, you'll build momentum and you will change your life. Just remember, the best is yet to come. So I hope you've learnt a little bit about knee osteoarthritis today, and I hope you have a better idea of what to do about it. If there's anyone that you think would benefit from this video, please feel free to share it with them. And if you are interested in programs or something, so you have a better idea of what to do and when to do it, let me know with a comment below, and maybe that's something I can produce in the future. All right, and thanks for watching, guys.